get it this time. I'm just gonna.
You're fine. Take your time. You're good.
Hello and welcome to this presentation about decreasing emergency department blood culture contamination here at Centegra Woodstock. My name is Nick Krugerberg. I'm a senior BSN student at St. Anthony College of Nursing. I'm completing this as part of my nursing leadership class. Today I'm going to go through a few topics to summarize blood culture contamination and how to decrease it. I'm going to go through the importance of blood cultures and how they can be used as a valuable diagnostic tool. I'm going to explain the effects of contamination and how they have and what impact they have on the hospital, the patient, and the nurses. I'm going to review the recent contamination rates here at Woodstock and then go into some common sources of contamination and ways to hopefully prevent them. After that, I will continue to talk about some causes of invalid results, because contamination is not the only way you can have invalid results with blood cultures. And then I'm going to go through the labeling procedure so that you can ensure proper labeling and quick processing of your blood cultures. Finally, I'll wrap up with some general guidelines about proper blood culture collection. So blood cultures are important because they're the best way to detect septicemia, so the treatment can begin as soon as possible. And the sooner you can start your antibiotic treatment, the quicker you can heal the patient, because untreated septicemia is 30 to 50% fatal. Aseptic cultures are required because you need to make sure that you know whether whether the blood contained bacteria or whether the bacteria was normal skin flora. And even though the common contaminants are known, you still can't be sure if there was contamination present or if there's septicemia present. And contaminated blood cultures can also result in false positives, which can have detrimental effects on the hospital, the patients, and the staff. So some of the patient effects of contamination are unnecessary hospitalization. Average stay for septicemia related to a culture contamination is 3 days, which is going to result in lost work and lost income for the patient, as well as exposure to possible hospital-acquired infections. And it's going to cost an average of $9,000 per patient per admission. It also results in unneeded antibiotic administration, which can lead to future problems by causing bacterial resistance and making everybody's job harder. Contamination also affects the hospital by driving up costs. It's been found that the cost of blood culture contamination adds up to about $1.4 million annually for the hospital. It also results in an increased census, which leads to higher workload for the staff and the loss of rooms for patients that potentially need it that weren't there as a result of a potential mistake. The recent contamination rates here at Woodstock were high. And as you see, in July of this year, there were 7 contaminated samples, which resulted in a contamination rate of 4.55%. In August, it went down, and the goal of blood culture contamination rates is to keep it between 2 and 3%. One of the most common sources of blood culture contamination is improper cleaning of the collection site. When you're using the chlorhexidine scrub, you want to make sure you scrub the site for 30 full seconds in an up and down, left and right, crosshatch configuration. And it's also vital to allow the site to dry for a full 30 seconds, because that's how chlorhexidine kills the bacteria. And through the drying process, it dries up the cell wall and causes cell lysis. So the drying is as important as the scrubbing. And obviously, if you have a patient who comes in visibly soiled in the area you're going to use for collection clean with soap and water prior to using the chlorhexidine. Repalpation of the venipuncture site is strictly forbidden, and this practice should be avoided at all costs. Because anytime after the site is prepared, it's sterile, and any contact is going to lead to contamination, because even in the practice of cleaning your gloves with chlorhexidine, it doesn't work, and it is an unacceptable technique that should be stopped. It's also unacceptable to get your blood cultures from an existing IV, because there could be contamination in the IV, the port could be contaminated, and when in studies have shown a statistically significant decrease in blood culture contamination when peripheral IVs were not used or discontinued as sources, culture sources. Another area that is very important for blood cultures is proper collection order. Blood cultures should always be the first blood labs taken, and the aerobic sample should always be gathered before the anaerobic, because once you access the vein, there will be some air in the collection catheter that, if you put that into the anaerobic container, it would invalidate the results. So an easy way to remember it is remember it alphabetically, aerobic before anaerobic. Other ways that don't involve the actual collection technique that can cause contamination are inexperienced or overworked staff. If there's a chance that while working you're going to need to get blood cultures, and you don't have time or you're not competent with your skills, that's when you ask for help. But the best thing to do is become competent and confident with your collection skills through proper training, following the guidelines set forth in the hospital guidelines, and if delegation is necessary, delegating to the proper staff that's experienced and can get valid results. Also, for the emergency department staff, keep in mind that the standard is that 50% of blood cultures must be performed by nurses, and 80% of all lab draws must be performed by the RNs, not the phlebotomy staff. Other sources of invalid results that don't relate to contamination necessarily are related to hemolysis. The hemolysis occurs when the red blood cells lyse usually as a result of too vigorous shaking. You only have to invert the sample 3 to 5 times in order to mix everything up and get it before you take it to lab. You can think of the red blood cells as water balloons. If you shake them up too much, they're likely to burst, and then the results won't be valid. Another thing to make sure of is to remove the tourniquet within 1 minute of application, because the hypoxia can also lead to lysis of the red blood cells. Proper filling is essential also. Underfilled containers provide invalid results and are rejected by the lab, so you want to make sure you have the necessary amount of blood within the vials, 8 to 10 mils for adults, 2 to 4 for pediatric patients, and half to 1 mil for newborns. Before you get your blood cultures, before you collect them, you want to make sure to check your containers to make sure they're not past the expiration date, or that the disc in the bottom is not discolored. The disc should be gray, not yellow, so easier to remember is gray is good. Proper labeling is essential for both diagnostic use, documentation, and ensuring that any problems with collection are identified and solved. So every blood culture should include the RN initials, the time of collection, the collection site. These labeling The labeling technique is the same for RNs and techs, so it's important to write legibly as well. After collection, it's essential to document. This is a practice that hasn't been followed a lot lately in the unit, and it needs to change so that tracking and accountability can be ensured. So within T-System, you would document the procedure. You could select the blood draw and document the site, the collection material, and the collection location of the blood culture. And this allows any contamination that potentially happens to be followed and fixed. And it's very important for everyone to understand that the person the RN or tech who collects the blood culture should document it as well. So to wrap it all up, the guidelines for great blood cultures include proper cleansing of the site for a full 30 seconds, scrubbing in the crosshatch configuration, and then allowing the site to dry for a full 30 seconds. Even though it seems like a long time to spend a whole minute scrubbing and letting the site dry, the risk of blood culture contamination is worth this time. After you clean it, don't repalpate it. All you do is contaminate, and then you have to wait another minute, or risk contamination. Sampling from 2 separate venipuncture sites is essential for valid results. Delegate when appropriate, because overworked workers can lead to worse technique and maybe oversight. Avoid hemolysis by not shaking the sample, and label properly and write legibly above all so that everyone knows who collected which sample. Finally, documentation in T-System, because if you don't document it, it never happens, as we're always told. This time, any questions? And I want to thank Christine, Roxanne, Stephanie, and Joan for all their valuable input in helping me put this presentation together. Thank you.